Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan Qasim, and our guest today is Nik. So, Nik, if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Thanks, Dan. Thanks for having me on. I'm excited to share more about me and my journey in entrepreneurship and tech. My name's Nik Vassev, based in Vancouver, Canada, tech entrepreneur, working in digital health. I've been working in tech for, about 12 years now. Started off in data analytics, cybersecurity, more in sales and marketing. And then about 4.5 years ago, I started my first tech startup, which was the world's first app for psychedelic therapy, which I built and sold to a biotech firm. Now I'm working on another new startup in virtual reality, where we're creating extremely engaging stress reduction solutions that take meditation and breath work and make it more engaging and effective.
Awesome. So can you talk more about what you're currently working on? So who is your typical customer and what does the user experience look like?
Yeah, for sure. So NovoBeing's a lot like, I guess it's not a lot like anything because there's not much of it like there, but maybe I can share the story of just about how it came about. So several years ago, my co-founder was really battling through some of the toughest times of his life. His dad was going through a cancer treatment, and he noticed that there wasn't really amazing holistic health practices that could be easily followed during these very stressful times. And what he found is that proven treatments like meditation, breath work, cognitive behavioral therapy, positive psychology are just really hard to deliver at scale and in an affordable price. And a lot of the times, especially when you are undergoing cancer treatment, you are in a situation where, you're trying to kill the tumor, trying to kill the cancer, but your mind and your spirit is the part that's overlooked. So several years ago, my co-founder got together with the head of digital health at Harvard, Dr. Al-Jawari, to create an immersive solution for patients undergoing cancer treatment. I joined initially as an advisor, then as an investor, then as co-founder, and I've just been so excited about leveraging this brand new virtual reality technology that is finally ready for the mainstream and really taking these proven clinically validated interventions and just making them more engaging and more accessible to more people.
Makes sense. So are you in beta right now, or do you have paying customers using you?
So we have paying customers. So right now NovoBeing's used in 6 hospitals. We've launched 3 clinical trials. We have results on our first clinical trial showing that our product's effective in reducing anxiety, depression, as well as pain. And then we also have, our first 2 paying customers. And right now we're working on a distribution deal with a large scale medical device distributor and manufacturer, which will really allow us to, get into thousands of healthcare facilities. So our product has gone through many different iterations, and we're finally really getting to the point where it's really good and it works, and we're kind of figured out a lot of the kinks through the clinical trials and through a lot of the feedback. And then also for any of the listeners, if you do have a MetaQuest headset, you can actually download NovoBeing for free still in the App Store. So we have a beta version of our consumer app that's out in the MetaQuest store, and we'll be, effectively, it's going to be turning into a subscription stress reduction app in the future in the next several months. So if anybody wants to give it a try, now is the time to get it for free.
So as of right now, all of your customers, it's all B2B, and then you're going to launch a B2C version here in the next few months.
Yeah. So our B2C version, we just launched something small just to be able to kind of get feedback and figure out what works, what doesn't work. And then for the last several months, we've been working on that, B2C version. And, you can think about it as, what Calm and Headspace did with the mobile phone 10 years ago. This is what we're trying to do right now with the VR device. And, we're literally at the same spot right now where, these devices are finally, affordable enough and powerful enough, for people to want to buy them. And the data is clear. The MetaQuest device last Christmas outsold the Xbox. We're having like several $billion worth of, subscription revenue being delivered through the Meta Quest device. And, the data right now for this kind of Black Friday, sales thing is like impressive. And Apple's new headset releases next year, probably like March, maybe summer timeframe. And then I think that's really going to open it up for, everybody wanting to get a VR headset, which I think is really, the thing that we're hoping for, because, it's such a powerful technology. And it just, it's had some trouble, as as you've seen with, the whole metaverse hype from last year. I feel like a lot of growth has happened since, and really the VR industry is maturing.
So if a hospital is buying from you, are they just providing these headsets for their patients, or what does it look like for the hospital user journey?
Yeah, so NovoBeing's designed to be used in healthcare's most stressful settings. So, some of the most common uses are if you're hospitalized for longer than 2 days. So, a lot of surgeries happening, or, you got hurt. We really look to, enable people to have a better experience with that through our stress reduction tools. And a lot of it actually, what's really interesting is it's the ability to actually exit the hospital and go to a beautiful beach, or, to a forest, or to the northern lights, instead of looking at those four walls all the time. That's like a huge part of why VR works in healthcare. But we're looking at long-term hospital stay, chemotherapy, dialysis, doctor and patient well-being support. And then we're also in the process of developing an MRI acclimation application for children, which helps, kind of young kids, maybe 6 to 12 years old is what we're targeting, be able to not be afraid of going into an MRI. So it still involves a lot of mindfulness, but it's actually kind of like a video game. And we've partnered with St. Jude's Hospital, which is a really amazing research institution where we're actually developing that product. And we have a clinical trial coming up. So, probably you'll hear about our MRI product, next summer is really where we're aiming to launch that. But we're really looking at, how do we make the lives of people in the most stressful, times of their life better, as well as people at home, because, how business goes and how life, modern life is very stressful. So we all need a self-care regimen. And I think that's what we want to offer on the consumer side.
Makes sense. What would you say is the biggest challenge that you face in your business today?
I think the biggest challenge is that's a really good one. We want to do so much, but we've had very limited capital. So there's been very limited investment going into kind of virtual reality that's not entertainment. And we've really been, one of the early pioneers of using virtual reality within healthcare. And, as good as going after the healthcare market is, we've also, you can play a video game and you can really see like, oh, this video game is great. But if you create a digital health intervention to treat a certain condition, there's a long lag until you don't know if it's working or if it's good. So we've just been going through that process where, we've been trying to get more investment, but we haven't been able to prove that our product works. But now finally, we have clinical data showing that our product works, and then things are really turning around. But I think the biggest challenge that we've had was just, getting enough capital to be able to get us to build the things that we're looking to build. But I think that's probably the biggest challenge of all entrepreneurs in early stage, disruptive industries that don't have, the crazy VC backing. But, the way that the economy has been and the whole metaverse bubble popping have just been all interesting headwinds that we've had to overcome. But I think at the end of the day, it just really builds that resilience. And then also you really understand, like who is a missionary and following your mission, and who's a mercenary who's just, wanting to get paid. So our team is very mission driven, and we're very proud of, the work that we're doing. But I think, like with all startups, that there's so many different aspects just because you don't also have the human resources to do everything. So a lot of the times the founders have to, carry a very heavy load, in the early stages of the company until you can really bring more talent to make that vision a reality.
But I guess like even early on, right? Like how did you convince these hospitals to give your product a try? I'm sure that wasn't like an easy conversation because it is so new and a lot of people are hesitant about it.
Yeah, I think it's a lot of it has to do with the approach that we've taken from a strategic perspective, and it's really looking at leveraging this technology to solve real problems. And I myself, having worked in mobile digital health before, I knew how big of a problem engagement is. Engagement in mobile is abysmal. So there's like a big research study that shows that most of the health apps, within the first 30 days, 98% of people stop using them. And we wanted to find out why is that. And a lot of the researchers that we're working with, they wanted to find out, how do I fix that? And we, early on had the hypothesis that, a lot of it has to do with distraction. People having very low attention spans, TikTok, Instagram, everybody wants that dopamine hit of entertainment. And when you have your mobile app competing with TikTok, you're going to be in trouble. But when you put on a VR headset, it takes you to a different place, and changing the environment makes you feel differently altogether. And then it removes all distractions. So then now you have a very, a much higher propensity to deliver these therapeutic interventions. So that was our initial thought, that maybe that's, a way to solve this problem. And I think we found the right researchers and clinicians that wanted to find that out themselves. So a lot of our early clinical trials are really like pilots to figure out, how does this compare to this standard operating procedures in the way that you currently treat this? And then also, is the benefit of VR actually that much of a benefit, right? Because, mobile, everybody's got an iPhone, but with VR, there's so many things. And especially if you are working with older people that aren't very tech savvy, how do you even solve that? And then how do you get the nurse to give the VR device to someone who's in a stressed environment is another piece. And how do you sanitize it? And it's just that opened up a whole can of worms that we've just been trying to figure out. And I think we're now, got to a point where we're like, okay, I think this is going to work. And it's really exciting.
For sure. Yeah. So obviously now 2024 is around the corner. So what are some of your goals? Like, where do you want to be next year? Even, for example, like approximate revenue, what would be a successful 2024 for you?
Yeah, for sure. So this year we're hitting close to 200,000. So next year we want to get to 2 million is our goal. So we're really looking at, delivering our products to healthcare at scale, and really have this scalability of our sales, our marketing efforts, and being able to then, confidently expand the impact that we're making. And then on the consumer side, we're building a mobile application. We're about to launch a personalization features, which make it even more engaging, where the experiences are based on your mood and stress levels, and also your preferences. And on a mobile app perspective, we also have been doing a lot of amazing stuff on biometrics. So actually integrating biometric data into this personalization, and then also taking this biometric data and then helping you better understand yourself. So how can we show that this experience that you just did was actually effective? And we leverage a lot of heart rate data to actually show you that, let's say you're stressed out about to do a presentation or something, and then you go and you use NovoBeing. We wanted to show you how much your heart rate dropped after the session, because that's going to prove to you that this was effective. Because a lot of the times feelings are hard to discern, but your heart rate dropping clearly shows that you're less stressed. So we're really looking at adding more innovative features. We're going to be turning on our subscription within the App Store, and then really kind of completing some of these clinical trials. So our clinical trial with Massachusetts General Hospital in Boston is really promising. The kind of initial feedback's been really great. So that will be published. We also have our University of Calgary study going to be published. And then we're starting 2 new ones, one for more doctor and nurse well-being support, and then also the one with MRIs. So then really it's like the research continues, the innovation continues, but then now we're really in a position where, we take our proven solutions and we sell them at scale. And then we also have our consumer app really being in a position where, you're going to want to use it every day. So I really wanted our application to be something that's part of people's self-care regimen. Whenever you feel a little stressed out or you want to get more focus, get some energy, you go and do a NovoBeing session and, change how you feel.
That's awesome. Like, what do you think is the biggest obstacle preventing you from where you're at now with 200K to getting to $2 million next year?
I think it's just executing now. So we're really, that's a big lofty goal, right? So for us is we just need to make sure that we're in the planning phase right now and really like planning, budgeting, having all of our tech roadmaps, across different areas. Who are we going to hire? What are some of the strategies that we need to do? There's a lot of prioritization in early business creation where you want to do so much, but you can't. So then you have to then make a priority list and be like, I think this would be more important than that. Even when you're building the product, that's like a major thing is like, I want all of these things, but we can't do it. So we're really in that prioritization to make sure that when it comes time to execute, we'll be able to execute. And I think, it's an exciting phase to be at where it really is about the execution, but there's so many moving pieces to it. And some of the, technology innovation that we're doing is extremely challenging. Some of these problems that the tech team's solving, the founders and business team may be like, yeah, the customers may really want it, but then is it really possible? And how long will it take for this to be an actual feature that is going to work at scale? So those are certain things that, we're always working on. But I think that's probably the biggest determining factor is, we do now have a very clear vision, a really good product that works. But then now it's like the rubber, it's the plane is taking off. But the plane, before it didn't have wheels and wings and nothing. So then now we have a plane and the plane's taking off, but then now it's like, how well are you going to drive that plane, up to your destination?
So speaking of priorities, like what is your top priority in like the next couple months?
Just these new product releases. So we're in the process of signing a deal with this company that has, I think over 50 sales marketing reps. They're in thousands of hospitals. So they're ready to sell our product. So then we're making a new version based on some of this new clinical trial feedback and, adding more features to it. So then, the next 3 months is really like getting it ready, for big time adoption. And then working out some of the kinks that may come from that. And then also there's a lot of regulatory things that need to happen too, because, working in healthcare is you have to follow very strict processes and procedures, and there's HIPAA, cybersecurity, legal, marketing. There's all the things that need to get done. So we're really, really making sure that the way that we sell our product, meets all the regulations, and we're able to then, create the marketing materials and events and collateral and actual packaging and delivery and customer care, to be able to do, because we know that people want to buy this product. People are buying this product. Like, we get all of these inbound leads and we're now really getting to the point where like, okay, well, how can we create the processes and systems to allow us to sell that product at scale? So that's kind of the main challenge that we're overcoming right now.
Makes sense. So what would you say is like the one biggest piece of advice that you wish you knew before you started this company?
That's a great question. I think it's just being more open to kind of letting go and not trying to kind of control the outcomes, and being open to things not working out and such, because sometimes, people have different characters, and I'm very achievement oriented, have my plans, everything's rolled out. And then sometimes it's not going, so you have to shift gears. So I think for me, it's been more, learning from others and advisors, trusting the team, and kind of letting go and saying, okay, maybe we failed here. Let's cut this out and let's focus all on this. And I think sometimes you have to be willing to like kind of rip things apart if you notice they're not working. So one of the biggest challenges that we had as a company was when we first started, we were really pursuing how can we create an insurance covered medical device that gets FDA cleared, and then we can help all the patients that are hospitalized. That was our initial thing. We're like, we're not doing anything else. We're only going to do that. So then that was a really big focus. But while this was happening, there was that issue where you can't prove that your product works. There's a big lag because all the clinical data has to come back, and that's like a huge thing. And then at the same time, that whole industry of digital therapeutics pretty much like went up in flames along with the metaverse at the very same time. And then we were out here, we were like, yeah, we have a VR, we did some like metaverse messaging with marketing. And then we also have this medical device, and then people don't even understand the metaverse or medical devices. And then most of the people really like the product because it helps them de-stress. So we were like, okay, like let's scratch all this other stuff and just focus on the thing that's working. And then that's when we rebranded the company, and then we kind of refocused, and we wanted to really become the best immersive stress reduction application versus the complexity of trying to find FDA clearance, insurance reimbursement, all of these things. We're like, hey, let's really shift the focus. But that was very challenging. Going through that, it was very hard because we were so gung-ho about what we're following, and we also invested a lot of money into that strategy. But I think sometimes you have to make those tough decisions, and you may have to let some people go. You may need to change your strategy. You may need to dump a product that maybe wasn't working and rebrand your whole thing. But that's part of trying to innovate and create and really it's sometimes also survive as an entrepreneur, because you have it's not only you, but you have your investors, you have your partners, you have your employees. There's a lot of things that are on your shoulders, and then you need to make the right decisions, and sometimes those right decisions are also very hard. So I think kind of letting that thing go of what's going to happen. Sometimes you don't, and you got to be open to saying, hey, this way is not working. I'm going to let go, and I'm going to try a different way. I think that's what we did with NovoBeing. And it's crazy how making those changes has like transformed everything. Like, our website traffic, our social media followers, just like the amount of inbound leads that are coming in, the new, financing that's happening. It's just like, it's crazy because it was just like, it wasn't that big of a shift, but it's like we found the way. And then now having the way, it's like, it's easier to perform at that point.
That's awesome. Yeah, iteration is really important, and listening to feedback, especially early on. So if somebody watching this wanted to reach out, do you mind sharing your company website or social media handle? Just best way for somebody watching to get in contact with you.
Yeah, for sure. So it's novobeing.com. So it's NOVO and then being, like wellbeing.com. And then you can also follow us on Instagram or on X, are really the main ones. And then you can find me, it's Nik Vassev, so VASSEV. And yeah, if I love speaking with entrepreneurs and kind of helping in any way possible. So yeah, if anybody is interested, I'd love to connect. I've been fortunate enough to have amazing mentors that really help me get here. And, we have a lot of advisors on our team that are, have been transformational in terms of the value they brought. And I think, a lot of entrepreneurs really like, talking about this, like kind of how you have your podcast. Like, I'm sure that, you really love having these conversations. So I also love having these conversations. So yeah, definitely connect with me and try the app too.
Awesome. Well, Nik, we're rooting for you, and thank you so much for your time today.
Thanks, Dan. Appreciate it.
Thanks. All right. Bye.
Bye-bye.